Howdy! This is Dr. Jen, your friendly OB-Gyn. Guys, ang pag-uusapan po natin ngayon ay isang napapanaw na topic tungkol sa endometrial cancer. Please watch this video up to the end and share this info to your friends and relatives to save them from endometrial cancer. Endometrial cancer is typically a disease of the postmenopausal women. It is most prevalent in women between age 50 to 70 years of age, and less than 5% of cases are diagnosed before 40 years old. The peak incidence of endometrial cancer is 55 to 69 years old. Endometrial cancer is the most common female genital tract malignancy in most developed countries. When the disease is diagnosed before the age of 35, it is usually due to unopposed estrogen condition. Just before menopause, about 10% of women with hypermenorrhea or abnormally heavy or prolonged menstruation will have endometrial cancer. Carcinoma of the endometrium is usually adenocarcinoma in 70 to 80% and adenosquamous carcinoma in 10 to 20% of cases. The role of estrogen in the development of endometrial cancer has been established. Most endometrial cancer arise from the background of endometrial hyperplasia, pagkapal ng lining ng matres, and are consequence of unopposed estrogen. Sa loob, endogenous sa loob ng katawan or exogenous nang gagaling sa labas ng katawan on a hormonally responsive endometrium. Yung tinatawag na endogenous estrogen ay yung galing sa loob ng ating katawan at yung exogenous estrogen ay yung mga kinakain natin na pinapasok natin sa ating katawan. Signs and symptoms. Postmenopausal women, the usual symptom is heavy vaginal bleeding, more than 80 ml per period, longer than 7 days. About 20% of postmenopausal bleeding is usually due to underlying cancer, with 12 to 15% usually endometrial in nature. The amount of bleeding is not correlated to the likelihood of cancer because even a small amount of spotting may represent cancer. The factors that increases the risk of endometrial cancer. Number 1 is infertility and history of irregular menstruation. This is as a result of anovulatory cycles. Number 3 is unopposed estrogen replacement therapy. Endometrial carcinoma is 4 to 8 times more common in women using unopposed estrogen for menopausal replacement. Hence, they should receive close clinical follow-up and consideration for cyclic progestin therapy. Menopause after 52 years of age has 2.4 times higher risk in developing endometrial cancer, probably as a result of prolonged exposure of the uterus to progestin-deficient menstrual cycle. Obesity increases the risk for endometrial cancer, 3-folds for 21 to 50 pounds overweight, and 10 times for those more than 50 pounds overweight. Next is femininity ovarian tumor like granulosa theca cell tumor. Another is chronic anovulation, like polycystic ovarian syndrome. Next is tamoxifen therapy for breast cancer for more than 2 years of use. That's why they have to undergo uterine monitoring through transvaginal ultrasound. Pag-usapan din natin ang mga risk factors na pwede natin magawan ng paraan, which is obesity. Okay? Try po natin wag mag-weight gain. Try po natin ma-achieve ang ating ideal body weight. Why? Because obesity increases the risk by increasing estrogen production and bioavailability. Most of the estrogen is in the form of estrone, which is produced in the peripheral conversion of androstenedione in muscles and adipose tissue. In addition, obese women have lower levels of sex hormone binding globulin. This accounts for the increased bioavailability of circulating estrogen. Sa social media po na napapanood natin ngayon na nagkaroon ng endometrial cancer, sinabi po niya na iwasan natin kumain ng mga fast foods. Sabi po niya kumain tayo ng tama kasi po sa sobrang pagiging busy niya sa kanyang negosyo, siya po ay kumakain madalas ng mga fast foods. So, anong kinalaman nito sa pagkakaroon niya ng endometrial cancer? Total intake of calories from unsaturated and saturated fats is a risk factor for development of endometrial cancer. independent of body weight. So makikita nyo po, hindi po siya pasok sa criteria ng obesity kasi po siya po ay hindi mataba. Slim lang po siya, kumbaga tama ang body weight niya, pero nagkaroon pa rin po siya ng endometrial cancer. Kaya it is said na it is independent of body weight. Because women who have high intake of animal fat and fried foods have 2.1-fold increased risk for developing endometrial cancers. So yan po ang correlation ng kanyang case ng pagkakaroon ng endometrial cancer at pagkain ng fast foods. The diagnosis of endometrial cancer is usually made through endometrial sampling. We do this after a patient presents with abnormal uterine bleeding. Special consideration should be given to postmenopausal women who bleeds after 6 months of menopause. In postmenopausal women, it is mandatory to assess the endometrium histologically because the chance of having endometrial cancer is approximately 15%. The diagnosis of endometrial carcinoma is established by histologic examination of the endometrium. Sa microscope po nakikita yon kung tayo ay mayroong endometrial cancer after po kumuha ng sample sa lining ng ating matres. So sa prognosis naman po, the single most important factor for endometrial carcinoma is the histologic grade. Histologically poorly differentiated or undifferentiated tumors are associated with considerably poor prognosis because of the likelihood of extrauterine spread through the adjacent lymphatics and the peritoneal fluid. The second most important prognostic factor is the depth of the myometrial invasion. Grade 3 tumor with deep myometrial invasion may have 5-year survival of less than 20%. 90% of cases occur less than 5 years. For optimal treatment result, therapy should be individualized by the gynecologic oncologist. Because endometrial cancer is a surgically staged disease, primary surgical treatment is the cornerstone of management. So, total abdominal hysterectomy with bilateral salpingo o operectomy are the primary operative procedure for endometrial carcinoma. So, ibig sabihin po, tinatanggal po natin ang matres at ang mga ovaries pag tayo po ay may endometrial cancer. Surgery and radiation therapy are the treatment modalities for endometrial cancer. Those who are not amenable may be treated with chemotherapy or progesterone treatment. First-line treatment for the recurrent disease is hormonal. Indicators of good responsiveness include young patient, high level of tumor receptors, well-differentiated tumors, localized or late recurrence. So now you know what are the risk factors. Ayan po, mag-start na po tayong alagaan ang ating mga sarili. Number 1 po, pagkain ng tama at iwasan po natin maging obese. Kung gusto niyo pong magkaroon ng family, tayo po ay humabol na. And please follow me for more OB-GYN infos. Hasta la vista!